Senator Maria Cantwell, thank you so much for being with us, Senator. Do you think this is dead? Do you think the Republican health care bill is dead?
No, I don't. I think that as long as people are going to keep bringing up this idea of just trying to get, the 50th, 51st vote, and people are going to continue to talk about capitating and cutting people off of Medicaid as the centerpiece, this is something that we have to make sure that we're strongly opposed to. It's not a smart idea. It won't lower the individual market premiums, and we have to get off of this concept.
One of the things that you wrote, you've tweeted a lot about this and talked a lot about this. You wrote, quote, "Now it's time to work together." So give us an example of where you think realistically you as a Democratic senator and your peers can do that and propose a change to Obamacare that the Republicans would accept. What are your proposals?
Well, actually, there's some things in the Affordable Care Act that we should put pedal to the metal. We should go faster on. One of them is this concept of focusing on getting people out of nursing home care to community-based care. This was something that we saved $2 billion doing in the state of Washington, and we incented in the Affordable Care Act. A few states have taken us up on it, but if we would do that together, we would help expedite huge savings. And who doesn't want to stay in their home in the last years of their lives? So it's a win-win situation. So that's a perfect example of huge savings people should be able to come together on.
What about when you're dealing with premiums? That, I think, deals a little bit in the realm of Medicaid there. What about premiums? What proposals do you have to reduce premiums? Because that's been a big concern here. For instance, would you allow people to buy insurance over state lines, for instance?
Well, yeah, their concept is basically cut people off or cut benefits. What I'm a little bit more in favor of is what I call the Costco model. When you buy in bulk, you get a discount. And New York has done this using the Affordable Care Act. They bundled up the individual market population above Medicaid rate, and basically were successful in creating 650,000 people who are buying affordable insurance there. That's what we'd also like to push out and get other people to do as well.
You have vowed to fight the Republicans' plan with, quote, every tool we have. How does that jive with it's time to work together? I mean, it's one, you fight them, you fight them, you fight them, or it's the other? Which is it?
Well, I believe in the information age, and I come from a state where we innovate. So the tools that I'm going to use is the court of public opinion, information, data, statistics, and better ideas. And when you can show people, like I just talked about, rebalancing off of nursing home care to community-based care, come to the floor and debate and tell me what's wrong with that idea, because it saves billions and it's a win-win situation. If you want to tell me about the individual market, let's discuss this idea of the basic health plan. Tell me what's wrong with it. Let's debate that. So when I say use every tool, I've gone to my state, many different locations, hearing from my constituents talking about this. They're probably pretty much for all these things, but they're also giving me examples, and we keep posting them. We want to have the debate.
Senator Bernie Sanders keeps on pushing a single-payer plan. Warren Buffett, who can afford really any type of plan, now says he thinks that a single-payer plan may be the best for the country. Would you be in favor of a single-payer plan?
I think that we should have that flexibility and that states should pursue that, and we should make sure that that is very, very available to people. I'm concerned right now that we also get a solution, and I don't know that we can get our Republican colleagues to be for that right now. So this New York plan, which is basically an option to bundle up the public and give individuals in the marketplace clout to get an affordable insurance premium, just like somebody who worked for a big employer, I think is I don't know if you would call it an in-between step, but it certainly is something I think we could get done today.
Just a quick follow on that. Where do you think, where can you point to that you think a single payer plan has worked exceptionally well? And just to clarify, you're saying you think a single payer plan would be the best option moving forward, even though it's not politically viable right now?
What I'm saying is there is a viable option that's working in New York, and we should be laser beam about it, and we should focus on it. And as I said, when you think about the individual market, you want to be able to bundle people up and have them have the same clout that if they work for a major employer, that they get health insurance at a lower cost. That's what we want to do for the individual market. I think the innovation of the Affordable Care Act, I've always supported states continuing to innovate, and I think that states who want to pursue that as an option, the single payer structure, and want to experiment with that, they should do it.
Senator Maria Cantwell of Washington, thanks so much for being with us. Appreciate your time.
Thank you.